Joining me now from Hong Kong is Dr. Tony Mok, the Chinese University of Hong Kong. He's chair of the Department of Clinical Oncology. Thank you so much for joining us. Dr. Mok, cancer is the leading cause of death in China, according to the American Cancer Society. So what kind of cancers are we talking about here, and what's being done to combat it?
Right. The most common cancer is actually lung cancer around the world, followed by that colorectal cancer, breast cancer in the female, and also prostate cancer. And all these cancer may have different incidence between China and the rest of the world, but certainly lung cancer is a leading cause.
So what is being done, do you think, in China to combat lung cancer? We know that there are some steps against smoking, but what else is happening there?
Well, there's actually a lot of research on lung cancer this day in China. So one of the major research groups in China is called CGTN, Chinese Thoracic Oncology Group. It's actually have become a very powerful research group among almost like 43 different institutes across China. Working together, they have actually produced some very good clinical trial that help to combat lung cancer, especially on the genetic mutated lung cancer, such as the EGFR mutation and the ALK mutation. And a lot of actually significant impact have been made over the past 10 years.
When it comes to some of the latest treatments with cancer, some of the latest medical advancements, what are you looking for? What are you most excited to see?
Well, I think the concept of personalized medicine is very important in different cancer. Take, for example, as I mentioned, that in the EGFR mutation, we only discovered this EGFR gene in only 2004. But since then, there have been tremendous improvement in terms of the molecular diagnosis. Not only we need to biopsy from the tumor, we can actually detect the mutation from the blood. And actually, we can make treatment decisions according to the molecular genetic changes based on this plasma DNA. And also, we move on from the first generation drug to now actually recently approved the third generation drug. With such, we can significantly prolong the survival of the cancer patient with the lung cancer.
You know, and as we reflect on World Cancer Day, would you say that cancer mortality has increased or decreased over the years? How close are we to finding a cure for cancer?
We may actually have made a small dent on the mortality of cancer in general. Now, back in the latest statistic in China, approximately 4.3 million was affected with the disease, and approximately 2.8 million people died from the disease. Now, with each single patient who died or actually affected by the disease, 2 to 3 family members was actually influenced adversely by it. So therefore, I think we have made some progress in terms of prolongation survival, but we have not made any major changes in terms of the incidence of cancer in general. So I think a lot of more preventive work needs to be done. For example, we actually do not know the impact of pollution on the incidence of cancer in China. We're just actually in the early phase of this impact, and certainly in about 2 decades, we may see the impact possibly being increased. So I think a lot more needs to be done in terms of environment as well as early detection of the cancer.
All right, Dr. Tony Mok, thank you so much for joining us from Hong Kong. We appreciate it.